Dr. Allison Pinto is a clinical child psychologist and research assistant professor at the Florida Mental Health Institute at the University of South Florida, where she coordinates START, which is Alliance for Safe, Therapeutic, and Appropriate Use of Residential Treatment. Dr. Pinto has coordinated public awareness and advocacy efforts relating to the mistreatment of children in private and unregulated residential treatment facilities. She also serves as a principal investigator of a qualitative study regarding the experience of youth and families who have participated in the residential treatment programs.
Good morning, Chairman Miller, Ranking Member McKeon, and distinguished members of the committee. Thank you for this opportunity to testify before you today, and I'm grateful for your leadership and your efforts to help protect youth from maltreatment by convening this hearing. I am Dr. Allison Pinto, and I'm a child and adolescent psychologist licensed in the states of California and Florida. I'm a member of the American Psychological Association, an assistant professor at the University of South Florida, and a researcher at the Children's Board of Hillsborough County, a children's services council in Florida. For the past 3 years, I have served as the coordinator of START, Alliance for the Safe, Therapeutic, and Appropriate Use of Residential Treatment. Each week, I receive phone calls and emails from concerned youth, family members, and professionals who are trying to navigate the increasingly complex world of residential services for youth, or to cope with the aftermath of their experiences. I've also spoken with a variety of individuals associated with the growing number of programs that are being framed as alternatives to traditional residential mental health care. Now, many parents and professionals are shocked by the descriptions of institutional abuse that continue to emerge regarding the care that American adolescents are receiving in alternative residential programs. In disbelief, they often ask, well, how do you know that these aren't just a few isolated incidents that have been sensationalized in the media? Or how do you know that these aren't just the complaints of manipulative, troubled teens or disgruntled parents? People are also in shock to learn that in many states these programs are not required to be licensed or regulated with regard to the education, mental health care, and residential services that they provide. In order to address this disbelief and to gain a clearer understanding of the variety of residential services that are now available for youth, we posted an online survey to systematically gather reports from individuals who participated in residential programs when they were adolescents. Within 6 months, over 700 people responded to the survey. The detailed descriptions that young adults have been willing to share through this survey provide data that reveal a highly disturbing phenomenon. While there are youth and families who are satisfied with the services that they have received, a significant number of adolescents report maltreatment in programs across the country. Survey findings reveal the following. Reports of mistreatment, abuse, and neglect are widespread. There were concerns expressed regarding 85 programs located in 23 states and in several foreign countries. Facilities are not maintaining health and safety standards, and youth are experiencing medical neglect and educational deprivation. Incidents of physical and sexual abuse have occurred that were never reported by youth due to threatening program environments or the absence of universal access to protection and advocacy hotlines. Treatment is violating human rights. In the guise of behavior modification, youth are required to earn their basic human rights to privacy, dignity, and contact with family members. Youth are being deprived of food, sleep, and shelter. They are forced to endure stress positions, humiliation, and intentionally fear-inducing encounters. Programs are also using cruel and dangerous thought reform techniques. The use of seclusion and restraint is highly, grossly inappropriate. These practices are being used as punishments for rule violations rather than only when a person is a serious danger to themselves or others. Youth are enduring painful restraint practices, and isolation for periods of weeks, even months, has been reported. Youth have expressed profound distress about their residential experiences. For some respondents, the memories of their experience remain deeply disturbing and have led to a pattern of anxiety consistent with post-traumatic stress disorder. So are these reports credible? Based on the level of detail and the overall coherence of the accounts provided, and using my clinical judgment as a child psychologist, I conclude that they are very credible. If those of us who are mandated reporters of suspected child abuse were to learn of this type of treatment occurring in a family's home, we would be required to file a suspected child abuse report so that the concerns could be investigated. We must consider the reports of maltreatment and abuse occurring in residential facilities just as seriously. Recognizing that the online reports provided are retrospective and are not necessarily from a representative sample of all individuals who attended residential programs, the survey findings nonetheless indicate that a serious problem has emerged. Because there are now hundreds of reports of abuse and neglect related to a diversity of programs across many states, these reports reveal a coherent pattern of institutional maltreatment. Once a pattern becomes apparent, it is not appropriate, scientifically or ethically, to dismiss reports of maltreatment as a few bad apples or a few noisy complaints. We must now acknowledge the problem in order to resolve it. Thank you again for the opportunity to present this testimony and for your efforts to safeguard and restore the well-being of American youth and families. I'd be pleased to answer any questions.